everyone. My name is Bhavitha, and I'll be discussing the importance of destigmatizing mental health on a global scale. Here's a little bit about me. I'm a rising junior at Basis Scottsdale in Arizona with a passion for neuroscience and psychology. At school, I lead the mental health committee at our library and run the Neuroscience and Neuroethics Club. I'm also an instructor at a nonprofit called NeuroEd, where I teach people who don't have access to psychology and neuroscience courses through their school. And I've done independent research on the role of certain genes in optic neuritis, a form of multiple sclerosis affecting the optic nerve. I'm also volunteering at the Cancer Research Center at my local hospital. In the future, I hope to pursue a career in either neuroscience or psychology and become a medical practitioner. Before I hop right in, I'd like to share an anecdote, and I'll tie this into my discussion later. So this summer, I'm also volunteering at a local public library. And one day I walked in for my shift and I noticed, based on his speech and behavior, that the person I'm volunteering with may have a mental health condition. And I'll be using that term, mental health condition, instead of disorder or illness going forward, because I feel it's a more objective way to refer to these stigmatized psychological and neurological conditions. I talked to this person throughout my shift, and 3 hours later, I walked out of that library having learned how to do math in hexamal. Base 6, which was something I definitely didn't think I could do before. The first question I'll be discussing is, why is mental health stigmatized so much? And to do that, we first have to understand where stigma comes from. Stigma starts mainly with misinformation. As people are misinformed through their own observations and assumptions of others, or through lack of education on a certain subject, they start jumping to conclusions about people. Furthermore, they generalize these conclusions to whole populations, when in reality, everyone in that population is different. The process I just explained is more commonly heard of as stereotyping. A stereotype, as defined by the American Psychological Association, or the APA, is a set of cognitive generalizations about the qualities and characteristics of the members of a group or social category, often judgmental and negative. Some common stereotypes you may have heard of include Asians are good at math, and teenagers are addicted to their phones. Of course, not all Asians are inherently good at math, and not all teenagers are addicted to their phones. Now, I want to make it clear that I'm not saying no Asians are good at math either. I'm just pointing out that there are Asians that are good at math, but there are also Asians that excel in many other areas. The same thing applies to teenagers' supposed electronic addictions. There are some teens who are addicted to their phones, but there are also many who are not. These stereotypes, especially the negative and prejudiced ones, are what create stigma around certain communities, including the community of people with mental health conditions. There are many stereotypes for people with mental health conditions, such as people with ADHD are unable to focus on anything, and people with anxiety are always nervous and socially isolated. This stereotyping, and consequently the stigma, is also prevalent in mental health conditions where people fall on a spectrum, such as the autism spectrum disorder. While people can be both mildly and severely affected by autism, the stereotype revolves around those affected severely and does not consider less severe cases. The negative assumptions about severe autism that are often generalized to everyone living with this developmental condition can create stigma. Like I said before, while there may be cases where these are true, there are also many cases where the stereotypes don't apply. Bringing back my anecdote from earlier, if I had just assumed the person I was volunteering with wasn't smart because he stuttered and kept twiddling his fingers, I would have never known he could calculate in base 6, and moreover, teach it to me in a way that I can understand. This perfectly demonstrates that not everyone diagnosed with a mental health condition fits into a cookie-cutter stereotype. The discussion of stereotyping leads us to the definition of stigma, the negative social attitude attached to a characteristic of an individual that may be regarded as a mental, physical, or social deficiency. This stigma is the basis of discrimination, which can affect people seeking help. It's important to realize that people with different mental health conditions have different needs, and they should be given an equal chance to get the care they need and lead their lives as best they can. 1 in 8 people live with a mental health condition. Why am I telling you this now? Well, with the amount of stigma and negative views surrounding mental health conditions, not many people willingly go to a doctor to seek help, be it through medication or therapy. In fact, several studies reflect a negative correlation between stigmas and help seeking, indicating stigma is a hindrance to people seeking treatment for their medical health condition. To put this into numbers, nearly half of the 600 million Americans with mental health conditions struggle to find mental health care. Help seeking also varies across various demographics, including age, gender, and ethnicity. Studies show that young people are the most likely to seek therapy from a professional, as seen in the chart below. According to information from the Centers for Disease Control, the CDC, women are more likely than men to receive mental health treatment, as shown in the chart to the left. The CDC's data also receives that non-Hispanic white groups are more likely than any other group to seek medical treatment for their conditions. One main reason for these differences in the treatment gap and for the treatment gap itself is, again, stigma. I want to add here that there are many reasons for the gap in treatment access for people with mental health conditions, such as economic difficulties. However, stigma is also a major contributor to the gap because people can be scared of being ostracized by society for having a mental health condition and are therefore hesitant to seek medical care. To conclude, I'll discuss ways we can reduce stigma, no matter where or who we are. The first step is to educate both ourselves and others and raise awareness. I mentioned at the beginning of this video that the root cause of stigma is misinformation. By properly informing ourselves and others, we can understand what people living with mental health conditions are going through. It's important to be aware of lesser-known mental health conditions. We may see depression and anxiety commonly, but conditions such as kleptomania are not as well known. If you don't recognize that term, I encourage you to go look it up. The next step is to adopt an open mindset. When people see someone who appears to have a mental health condition, their mind automatically may think negative thoughts. Instead, we just need to be patient and get to know these people to find out that they are unique and special in their own way. Another way to stop the spread of stigma is by being aware of your language, as I have in my presentation. Instead of using mentally ill, use living with a mental condition. And instead of saying psychotic, say person experiencing psychosis. Using words like disorder when referring to mental health conditions often creates a negative connotation, thereby feeding the fire and propagating stigma surrounding mental health. But by making these small changes, we can lift the negative stereotypes on mental health conditions and create a safer, more inclusive environment for everyone, regardless of their medical needs. Here are my references, more references, my contact information for those who would like to reach out, and I'd like to thank everyone for listening. A special thanks to the GHLC board for giving me the opportunity to present, to my family and friends for critiquing this presentation, and to you, the audience, who are listening to me talk about the things I think are important in today's society. Have a wonderful rest of your day or night.